Good morning.
Good morning, sir. May we start now?
Yes, please.
Okay. A very warm good morning and happy new year to all our participants joining from different parts of the world. On behalf of the Foundation of Healthcare Technology Society, FHTS, I, Dr. Shweta Jain, extend a heartfelt welcome to today's event. We are truly overwhelmed by the response to this camp event with over 200 plus registrations. And we sincerely thank you for your enthusiastic participation, and your presence truly reflects the importance of this topic, public health leadership. It's our honor to host a distinguished gathering, including the heads of our departments, schools, working professionals, and students who bring a wealth of experience and diverse perspectives from across various disciplines. Your presence here today reflects a shared commitment to advancing a healthier, more equitable, and more resilient future for all. This webinar is part of our ongoing camp series, the Career and Mentorship Program. Today's session is the fourth event in this series, and we are delighted to continue this journey of learning, guidance, and growing together. Before moving forward, I would like to welcome our today's speaker, Dr. Ashish Joshi. He currently serves as the Dean and Distinguished University Professor at the School of Public Health, University of Memphis. A visionary leader and accomplished researcher, he brings extensive experience spanning 12 countries, collaborating with community organizations, academic institutions, government agencies, and policymakers. Dr. Ashish Joshi is a renowned population health informatics expert, integrating his background in clinical medicine, public health, and informatics to design human centered, technology enabled solutions that improve population health outcomes. With a strong commitment to addressing social, economic, and health inequities, he leverages community based data to drive impactful innovations in public health education, research, and practice. Thank you, sir, for taking time out of your busy schedule to share the knowledge and learning from your vast experience in the field of public health. So, over to you, sir. You may begin now.
Thank you, Dr. Shweta. And thank you to everyone who took this Sunday morning, I think in India it's Sunday morning, to and attend the session. And the second thing is, wish you a very, very happy new year, first of all. I hope that this new year brings you health, happiness, and prosperity. But also, as public health professionals and broader public health professionals who are attending today, it also highlights the importance of our dedication and calling, that public health is more than just a job, it's a mission that we plan to accomplish. So, with that note, I would like to uh, take an opportunity to cover. This is, I think, my fourth one. I think, Dr. Sheta, if I'm not wrong. And the purpose of
Right,
this
sir.
career and mentorship program series is to basically share the knowledge, learn from each other, and facilitate network and collaboration. But more importantly, to highlight the importance of public health and the obviously of various dimensions of public health, whether it is on analytics, whether it is on informatics, whether we are talking about digital health, or we are talking as of today, which we are emphasizing is leadership. So uh, before I just go, I have a kind of an outline about like really why public health leadership and what is public health leadership, why public health leadership, what are some of the different theories and styles of that, what are some of the key attributes of public health leadership, and some of the examining of knowledge, skills, and attitude to achieve specific goals and what is required in public health leadership for that. What are some of the essential qualities of a public health leader, and what are some of the barriers to success in the current environment of public health leadership, and what's the way forward? The topics that are chosen because of some of the relevance and the applicability of these disciplines, specifically in the environment we live, which is very complex, very uncertain, and also very unpredictable. And that's why the topics that I've been choosing are kind of uh, this is, and I have to say here that this is just coming from a very lived public health experience. And I hope that by the end of this presentation, you take some words that might help you in some of what you do in your day-to-day life. So about myself, I always say, and thank you so much, Dr. Shweta, for the introduction, but I always describe myself a person who is very passionate to create impact. I like to live life with a purpose, and that I feel that giving is a blessing. So that's why sometimes we are very skeptical about sharing knowledge. And I think through this series, I do want to make sure that the knowledge grows when you actually share it with many. So it's not about just coming here and giving a topical presentation on leadership principles or something like that, but it's all about really engaging into a conversation with all of you who've taken the time and who also bring so much diverse expertise, wisdom, and learning. A little bit about myself, I've done my clinical training that has uh, given me the knowledge about evidence-based patient care management. But more importantly, my passion for public health grew specifically, when I lost my father. And the one thing which I always emphasized at that point was like, how do I really help save people? And obviously, with no understanding about public health during my clinical training, that motivated me to pursue my path towards more focus on prevention and population scale. So that's what motivated me to come to the US in 2002 to pursue my master's in public health and to really get an understanding that how do we bring evidence and practice together for the larger good of the community. The third is that we want to make sure that all the evidence and practice is then relayed to the people at the large. And that what motivated me to go for my PhD in population health informatics, where I try to bring evidence into practice and then create a smart solutions which are sustainable. And I don't know whether who my nominee audience is. These may be students, working professionals, researchers, but I want to highlight that no matter what discipline we are coming from, we must make sure that our research extends to the benefit of the community at large. That's the whole goal of this. We must extend our initiatives that are sustainable. Multi-sector is a very important element because sometimes different spectrum of life, health may not be the priority. Maybe education is a priority. Maybe family is a priority. Maybe the child's education is a priority. Maybe the parents are a priority. But remember that health is also kind of various of the factors that are contributing to improvement of the health. So we must have an understanding of how non-health sectors play an important role in influencing health. The third is accessible solutions, which means if the solutions which are being designed are only designed for few and not for all, then they might create more inequity into the delivery of healthcare. So our focus should be how do we really come up with solutions that are available and accessible to all. Affordable, if it's a solution that is about $5,000, how many people can afford it compared to how do we really come up with the solutions that anybody and everybody can afford? So affordability is a very important element. Reimbursable, which means there must be some ways that there is a reimbursement, whether if you're spending your time in education, whether you are seeking health care, whether you have a public health program, what is the return on investment on any of these things that are critical? And tailored means something that works for me may not be necessarily that will work for Dr. Shweta or Dr. Or Ritika or somebody else on the screen. But how do we come up with solutions that are smart solutions, bringing technology at the intersection of evidence into practice? So that's what the kind of my academic and research rationale. Whatever I'm going to share today or in the past experiences of my camp series has been through lived experience. When I went into my for pursuing for masters, I never thought that I will be an administrator. So I knew only that I have to get public health education. I should be knowing how to do data analysis. I should be an epidemiologist, or I should do health promotion. But over a period of time, I realized the importance of human resources. I learned the importance of project management. I learned even how to communicate, how to engage with stakeholders. And that's where your role evolves over a period of time. And so, being as a dean is not that you have an MBA degree, but you gone through a lived experience of being an educator and a researcher and bringing those skills together to be an administrator. And then I like to think out of the box, and I always encourage that innovation must be brought into a higher education. It's a very important element. And the reason I bring innovation is a key. Innovation is not easy. Okay. Having an idea is every individual, I believe, has an idea. The goal is how do we take that idea into an implementation point. Being entrepreneurial is requirement of the hour today. And even though as the dean myself in the School of Public Health, I always foster kind of innovation and entrepreneurship. And I never realized until I started engaging with so many stakeholders, both within the School of Public Health, within the university, within the city and state agencies across the globe, that you have to have some acumen about public health diplomat also. So I think roles evolve, and in a way that we are always a lifelong learner. And if you're not being a lifelong learner, then we'll feel saturated and stagnated where we are. So apart from that, my core expertise is being population health informatics research. I've been implementing digital health interventions across multiple countries in different languages. Uh, Established smart labs. Have secured grants in $25 million. And the reason I put this slide is not to brag about the things. It's to let you inform that we may be at different stages of our career, but if we are willing to go out of our comfort zone and try to pursue learning, we can actually overcome the challenges and the limitations of we may already have when we first get into the discipline. I published research papers. I put this slide because I remember for a year and a half, every research paper I wrote was getting rejected. So I did not knew why my papers are getting rejected until I learned from my rejection how to make it better. So sometimes you have to little bit learn from those failures or some of those limitations also. Created the global platform of Master's Science and PhD in Population Health Informatics, developed the first public health diplomacy lab. I'm very delighted to share that I strongly believe that public health education must be institutionalized at the school level. Bringing the education at undergraduate level is very late, especially with the current transformational environment in we live in, where students who are in middle school and high school are so much overloaded by information, they must be given training on how to delineate between what is right and wrong. So public health is going to become very critical as a part of high school model. Uh, I am on the board of directors for ASPPH. Thank you for ASPPH. I want to acknowledge that. Traveled widely across 25 plus countries. So I think everything is coming through lived public health experience. It's not just the knowledge from the books. It's actually meeting people on the street from different countries and talking to them, engaging with them. And also having my own incubator in Delhi has taught me a lot over the last 13 years. Sometimes hiring of people, sometimes hiring of freshers, sometimes hiring of experienced people. So those each experiences teach you something, and that's what this public health experience is. Coming to a point of defining leadership, leadership, there's different ways of how people define. And to me, the leadership is like knowing yourself very is important. Like knowing yourself, have a vision. And sometimes I even say, how many of us are being taught on how to develop a vision in our curriculum? It's a very important aspect. So we can be taught about data, we can be talked about analytics, we can be talked about informatics, we can be talked about health promotion. But how many times we teach how to develop a vision, how to write a vision statement, how to write a mission? What's the difference between vision and mission? And how do we really communicate that vision to the stakeholders who may or may not be coming from your own background or with the same academic interests? Then, how do you build trust among colleagues? And at the same time, how do you take effective action to realize your leadership potential? Secondly, leadership is not about individualistic growth. It is not about I, it is not about me, it is about us and it is about we. And that's what leadership is all about. So, what are some of the principles of leadership? And I'm not going to read through the slides. I normally don't like, but I prepare the slides just for my audience. I just like to speak from what my experience has been. Leadership, you involve broader engagement, and sometimes don't always feel that leadership will always be appreciated. You are in a role of leadership because you must have the courage to make the toughest decisions also. So those tough decisions are not always the decisions which everybody will like, but you have to know how to make tough decisions for the larger good and for the more institutional growth. Institution does not mean, oh, my university will grow or my school will grow, but institution is how does it impact the community at large? Then, of course, having a vision is not enough. Having the ability to engage with the stakeholders is not enough. What is also important is how do you communicate your vision to the external stakeholders? So, communication is a key component. Then, some of the principles are championing the solution to organizational and community challenges. So, of course, we are love to do research, but at the end of the day, we also need to realize that we must create the solution that could support both the organizational and the community goals and objectives. Energized commitment to goals, and leadership is always to in a very current environment is has to be very creative. So creativity is a key pillar to leadership today. We live in an environment of limited resources. We live in an environment of so much uncertainty and unpredictability that we have to be creative to diversify of our resources, diversify in terms of what are the ways that we could build our partnerships, what are the programs that we need to think through, and also have the vision not to think just about the present, but also to see things what might be coming in the future. So leadership principles are built upon these certain attributes that are critical. Now, before we go into that, there are several theories in healthcare about leadership. And I thought like maybe just going over some of those theories might be very interesting. So the one of the very earliest theories in leadership was the great man theory. Here, leaders are inherently born with certain traits that make them natural leaders. So this is what sometimes the great man theory talks about. Possess extraordinary qualities such as charisma, intelligence, wisdom, and courage. We enable them to shape history and lead effectively. This theory suggests that leadership is not something that can be learned or developed. That's what the great man theory talks about in healthcare. Yeah, somebody, oh, he is a gifted person. He's born with that. Maybe they have something different, unique that makes them a great leader. But then we move to the second theory that's called the trait theory. There are certain personality traits that are key indicators of leadership potential. It asserts that individuals who possess those traits, such as self-confidence, decisiveness, integrity, and intelligence, are more likely to be effective leaders. And I don't know, but I will share my own experience. Like, as a child, I was not an extrovert child. I was a very introvert child. And until uh, I got exposure to the real world with the sudden death of my father. And all of a sudden, you become a responsible person, and that means you are going to make those decisions yourself. So, situations and circumstances can sometimes get the best out of you or can make you go the most like down. So I think the traits theory talks about the personality traits. Unlike the great man theory, which focuses on inherent nature of leadership, the trait theory suggests that these leadership traits can be identified and measured. Then there's a behavioral theory. This is a real shift which happens over a period of time where somebody who is born with the trait versus what you do is important of and not just about who you are. That doesn't mean that a person who is sitting on a zone of authority is a good leader, you know. But what you do in action is a reflection of your leadership. Leaders can be made through learning and experience. It is a result of specific behaviors that can be observed, taught, and replicated. This theory suggests that anyone can become a leader if they learn the right behaviors, such as effective communication, decision making, and the ability to inspire and motivate others. So, in that context, in public health, we always say that leadership can be developed through education, training, and practice. So that's an important element. So we must, before even going and jumping into, okay, what does a public health leader should do, we must have some understanding about what are the theories behind leadership in healthcare. Then there's a transactional leadership theory. It's a very interesting way. So it's based on system of rewards and punishment. You get a good outcome, you reward somebody. You don't have a good outcome, you punish somebody. This is called transactional leadership theory. Now, in certain cases where goals, priorities are very clearly defined, some people try to follow this transaction to ensure that there is like a kind of compliance and performance that is measured on that. But this style is often associated with management rather than leadership. So there's a difference between public health management and public health leadership. So in healthcare, transactional leadership might be used in environments that require very strict adherence to protocols and guidelines, maybe related to our administrative operational settings, for example. But it may not be sufficient in environments that require innovation and adaptability. So, and that's what leads to our next theory, which is transformational leadership theory. Here, the ability of leaders is to inspire, motivate followers to achieve more than what is expected of them. It requires people and the leaders to push people to get them the best. Sometimes it might be viewed, oh, this person is telling us to do this. The person is telling you to do this is not because the person wants more work out of you. The person wants the best out of you. That's a difference. So in transformational leadership, sometimes change might be viewed as negative because people might say, "Oh, I don't want to change because that's not how I do things." But they may not understand that it's not that somebody is asking you to do more, but somebody believes in you and thinks that you can be a better, give your best. So it's actually an opportunity to inspire and motivate others. One should be able to focus on the big picture. You can't look at the nitty gritty things on a day to day things, but you have to have at least a macro vision which it could inspire others towards a shared goal. Now, there will be individual interests, but you must understand that there's a macro of big picture with a shared goal vision. You can only grow when you all are contributing together to a common shared goal. They are often seen as change agents. That means they foster positive organizational culture, which is a very, very important element. Like, positivity is a very important element. And motivate followers to exceed their own expectations. So many of the times, whether when I was evolving in my own role, I used to ask many times to my mentors and say, okay, I want to bring this change, but I think I'm being viewed that maybe this change is not good change. And then I started to learn that no, they were expecting me to do these things because they feel that I could deliver on those things. So I think we need to understand that transformational leadership is, or not just bringing change, but also lead by example and be able to make some tough decisions and able to see a much bigger picture. You just can't teach in a class and say, okay, here's the slides, go around, and now you're going to become a leader because you have done your, I don't know which degree. Leadership comes from action and practice, and that's very important. Particularly valuable in healthcare, it helps to navigate a very complex healthcare delivery system, foster collaborative and supportive work environment. Then there's another theory which is very interesting. It's called contingency theory. This theory suggests that there's no one size that fits all approach to leadership. So in some situations, you will use transformational theory. In some cases, you might use behavioral change theory. But the effectiveness of leadership style is contingent on various factors. And what are those factors? They could be the situation we are in, some of the tasks that we are requiring at hand, and what are the characteristics of the followers that we are intending to do. So successful leaders are those that can adapt their style to the specific needs of the situation. So which means today leadership requires flexibility, it requires adaptability. It does require resilience and it does require empathy. So in public health, where leaders often face a wide range of challenges from managing crisis, whether it was crisis related to COVID or some another health threat, Or, for example, the crisis which we see currently in India in Indore, where the water quality has been a problem. The ability to adapt their leadership approach based on the context is critical for success. So, as we cover some of these theories, there has to be some distinction between what is leadership and what is management. They are related, but they're not the same. Person can be a good manager, a leader, but they can be both or they can be neither. So there are certain differences between leadership and management. Leadership deals with the vision, the structure, the mission, and the result effectiveness. It focuses on the top, larger, big vision. Values, objectives are very important role in leadership. It inspires, motivates people. Why? Because you want to have a common vision with a purpose. And it does emphasize on transformational aspects. And so, therefore, transformational leadership emerges. Whereas management, it deals with systems to get on cost benefit analysis, logistic procedures, what are the resources, very bottom line thing, controlling and monitoring results, tracking progress, indicators, key performance indicators, and how to solve the problems if there is any kind of a deviation from achieving the goals that are there. So even though that there's a very thin line and a gray line of leadership and management, but there is a distinction between these two things. So now we just cover a little bit about leadership styles. Now there are several kind of leadership styles. One is authoritarian, delegative, servant leadership, participative, authentic, complexity, distributed, adaptive, and situational. I'm just going to give one understanding about what this definition is, but I also want to highlight in what situation you can use this leadership style, because each style has its own pros and cons. So one way I can come and say, okay, this is what is authoritarian style, and then somebody might say, oh wow, but they may not know when to apply what things. So our goal is not to just say this is, but then the importance is in what situations you can apply each of these leadership style. So in this provide clear expectation for what needs to be done, when and how. This is very little input from group members. And in what situations you apply this? Best for situations that require rapid decision making and strict control. So for example, I'll tell you, during COVID-19, you may not have the time or the crises are in hand that you might take input from a lot of people. You must make independent decision very quickly because of the nature of the problem. So that means it's not a bad thing. It's a thing which is situational thing. So we must recognize what are the situations under which we are taking those decisions. Delegative. Often it offers little or no guidance to group members and just leaves decision making to them. It's very effective with highly skilled and self-motivated teams. When you are fully responsible, you say, you know what, I really don't need to intervene because I have delegated and designated my team to do most of the work. And you have the full confidence that they will deliver because they're self-motivated, not necessarily that they are waiting for the instructions, but they are self-driven, they are more proactive, and they're not reactive. Servant leadership. This is a very, very important component. It does prioritizes the needs of the team members. It also helps them to develop and perform as highly as possible. There are certain aspects of leadership style: humility, empathy, and commitment to serving others. I run an incubator. I tell everybody, that public health is not a job. It is a calling. It is a mission. It's not a 9 to 5 job. We all come into public health because we want the best to help the community in the best possible way. That does not mean that you have to work from 9 to 10 p.m. But we must have the humility and empathy and the commitment to serve others. So in this case, value collaboration and team development is a key element. Then there is a participative leadership style. It involves group members in decision making. Leader retains the final say, but he or she gets values input from others. Useful when diverse input and creative solutions are needed. So you bring different perspectives, but at some point you have to make a decision for that. So it's a very democratic style of participation. Authentic emphasizes the building the leader's legitimacy through honest relationships, with followers based on ethical foundation. You must have ethics and principles. It's effective in creating trust and loyalty within the team. And so some people are very open in conversation with the team. Some people may be very reluctant to talk everything. It depends in what situations you are. But each leadership style has some aspects of pros and cons in the different situations that we are always in. Then there's a complexity leadership. It emphasizes adaptive, enabling, and administrative functions, and it's very necessary in a highly dynamic and complex environments. Because healthcare organizations and public health programs, policies, they are very complex. In this case, leadership must emerge from interactions within the system. Then there's a distributed leadership style, which shares leadership responsibilities among various individuals and teams, and then builds more collaborative environment that requires diverse expertise. So for example, let's say we want to solve a issue of, I'll give you a simple example. I want to come up with a community based program. Let's say there's a diabetes program and we want to educate the community in an urban poor setting, for example. What do? We have teams that are being built. We want to have people from anthropology, we want to have people from public health, we want to have people from technology, we want to have people from economics, psychology, management. That means we're bringing people from diverse backgrounds to foster and facilitate this collaboration among these expertise that will allow us to create more collaborative environment around us. Adaptive is adaptive to changing environments with frequent changes and evolving challenges. So, for example, in COVID, things changed very quickly from one to another, and the decisions were supposed to be made as more and more data was coming, more and more evidence was being generated, policy making was making decisions. So, you must be able to adapt to the frequent changes and evolving challenges that happen. And then there's a situational leadership style. In this case, leaders must adjust their style to fit the development level of the people who they're following. It's best when dealing with teams of varying skill levels and experience. So some people come with a very wide range of 10 years of experience, some people are freshers. How do you really adapt to those two different audiences with varied skill levels and experience? Now, you can't apply the same leadership style in all the situations, but you can trying to do mix of different leadership styles based on the situations you are in. So how do leadership skills are beneficial? Somebody says, okay, why do I need to have a leadership skill? One, ability to find and utilize the most helpful information so you can make an informed decision. Individuals can have an ability to cooperate, encourage others. And one thing, sometimes we want to take a leadership role, but we don't want to take a decision-making role. So it's a very interesting thing. I want to, yeah, somebody wants to be a leader, but they don't want to make tough choices. So they are in the position because they have to make good and bad choices also sometimes. Bad choices doesn't mean bad decisions, but tough decisions, tough choices. Ability to have multi-level communication, and they must function as a systems thinker. So, which means that a linear thinker, which is saying that, okay, if there is a problem of A, let's say there's a country A and they have a problem of, let's say, traffic. They need to know that they need to work with different dimensions of the system to solve that. So that's where the leadership's skills come as beneficial. So what's the goals of public health leadership? Uh, And of course, I'm trying to give the initial slides were more focusing on the foundations and principles of leadership, and in the second part we go into more about public health leadership, and then we talk about the way forward. So that's the approach I'm taking through this presentation, and I'll be happy to answer any questions after that. The goal of public health leadership is that we need to change both the way we are training our public health students as well as the impact that we want to cause on our healthcare system. So, for that, we need to educate a new generation of leaders. Leadership is not meaning that we are sitting on a title and then not able to make the right choices or the tough decisions in all situations and not just in always good situations. Public health leaders must have breadth of perspective and influence that exceeds the bounds of any given discipline. So, as public health leader, you are not going to just engage with your fellow colleagues. In public health, you will be engaged with policymakers. You'll be engaged with probably transportation sector, urban planning sector, maybe finance, maybe trade, maybe security. I don't know, maybe multiple sectors. So teamwork and professional recognition is very important. Placements, practicums, cross-venue site visits, and variety of other techniques can be used, which means public health leadership must institutionalize that individuals can acquire those skills not just necessarily by working in a health sector, but they can actually learn this even in very simple case studies approach in an immersive educational programs. So what do public health leaders actually do? One, obviously, they plan, implement, and evaluate health programs, policies, services. We, public health leaders, also address social, environment, economic determinants of health in the community. They do advocacy for all vulnerable groups to modernize both public administration and public governance. We must respond to crisis communication. It's a very very important element. So how do public health workforce or public health leadership is trained during crisis communication is a very important element. Emergency planning. How do you really mitigate risks? How do you really plan if something of an outbreak happens? If there is a response to a bioterrorism event or an environmental catastrophe, disease outbreaks under threat to public health. So there must be trained to respond to these kind of things. And obviously, with the very rapid digitization and evolution of technology and data, we must know how to leverage these platforms to bring and conduct research and evidence-based practices. So, in effective public health leadership, and these are some of the things which are both taken from the literature and from my own lived experience. Integrity is a very important component. Sometimes we have to we need to be very open and transparent about why we are doing certain things. Decisiveness is a very important element. You know, I always say ability to balance between hard truths with optimism. Hard truth is not always easy, but we have to make certain choices. Transparency is a key element. Encouragement of risk taking. Sometimes we have to take risks. Sometimes things will work, sometimes things will not work. And ability to influence others are some of the core characteristics of effective public health leadership. And then I said, okay, let me talk a little bit about attributes. So there are three key attributes in this case. One, we must have a vision. How do we create influence? And what are the values that public health leadership should have? Vision, influence, and values. Those are very, very important. And these essentials have evolved over a period of time. So I want to mention, it's very interesting. I put this slide specifically in response to COVID-19 pandemic. In COVID-19, public health leadership was challenged in a way that many public health leaders were not trained in a way that way. So I would just want to bring those key elements to your this presentation today. One, to have a very proactive rather than a reactive initiatives, which means we must take initiatives that are proactive and not just reactive. Curiosity, implications of the scientific advice they were giving, particularly its feasibility, and very important things, how one's advice should be adapted to the context and framed in ways that make it most likely that it will be accepted and implemented. So communication was a key element in this case. Yeah, curiosity. How do I really bring forth my understanding of what's available out there so that it is not only just my assumption, but it is driven by data, but then it is likely to be accepted and implemented. So how do we really reframe the questions and reimagine public health in a different way? Broad view, ability to take a broad view of health threats. For example, when COVID-19 happened, so all of a sudden we said, okay, let's shut down. Shutdown will have impact on economy, businesses, small of businesses, schools. So somebody must have the ability to understand that their decision is not limited to improving the healthcare, but also will impact many other dimensions that are beyond healthcare. Recognize opposition. Not every decision will go in favor. You must have an understanding that not everyone is committed to policies and that protect and promote health. So, what we must be taught is growing literature on the commercial and political determinants of health. We must be taught about that. For many years, we've been focusing on social determinants of health, but we must recognize that there's a commercial aspect of health and there's a political determinant of health. And that's why, as I said to you, leadership curriculum, leadership training cannot be just limited to the foundation and principles what has been in existence for a long time. It requires adaptability both in practice and in teaching. Speak truth to power. This is very important so that it's not easy. You might be, let's say you are a public health department director, but you are reporting to the higher authorities. You should have the ability to speak truth based on the evidence, and then ensure that you can engage the policymakers and the politicians against certain interests. Be confident, which means engage all those who make things happen and have the confidence to engage with those from other sectors. Uphold values. We are public health professionals. I have always believed strongly over my last 20-year career in public health that values in public health are very important, and that's why we are in public health. So we must have an ability to have commitment to see problems through the eyes of others affected by them and work with them to find solutions. Lastly, we cannot emphasize enough the importance of communication. Now, communication traditionally was, I can meet, I can have my pamphlets, I can have a print booklets, but today the world is going in the field of misinformation, disinformation. So, public health leaders must be knowing on how to use communication media. I know myself, sometimes I've hired my own team members and I ask them, can you do social media? They say, oh, no, I'm not a social media person. I'm a public health person. I'm a public health researcher. But public health researcher has to communicate the findings of their research to the public. That's communication. So we can't just view ourselves as linear thinkers or as singular approach of learning. We must think from the systems thinking, have the ability to use multiple tools. How do you approach media? If you are asked a question in an interview in a news channels, how do you respond to that? We must have programs that simulate these kind of situations. So a little bit about influence. Influence is essential to achieve widespread change. So if you, let's say as a leader, you've created a program. Now you want to amplify, scale up the program so that it can be influenced. So that means one, you must have understanding about the bigger picture. You must have systems perspective. And very important, you must know how to connect interdisciplinary, interagency, and inter-organizational network. It does comes through broader recognition and respect. The values and competencies are very critical. I only highlighted here servant leadership because I strongly believe that servant leadership, inspirational leadership are two very important pillars for a transformational leadership. Servant leadership means that you have to be humble. You have to look at things from the other perspective and then respond to the situations. In public health leadership competencies, knowledge, skills, and attitude. And I hope that when you go back today, you can think through, okay, how can you develop your skills in public policy? How can you gain knowledge about how to do strategic planning? How to manage information that is coming from different social media platforms? What is cultural competence? Don't read about it, apply it. So you must understand how to apply these knowledge, skills, and attitudes because that's how your competencies are assessed. Human resource. I remember one time I told somebody that you have to do HR hiring. They said, oh, I don't have an MBA in HR. No. Even as a dean myself, I don't have an MBA in HR, but I must have enough knowledge that I can work with the HR. That does not mean that I have to become a human resource professional, but at least I should have the knowledge, skills, and attitudes on how to work with the human resource professionals. So I think we need to little bit come out of our tunnel thinking and get into a very broader understanding about how public health leadership needs to evolve. Communication with multiple audiences. I highlighted these key Six elements which I believe in the current environment and the environment we are going into, we will be needing this. Communication with multiple audiences is a key element. And multiple audiences means not just policymakers or politicians or global organizations, but it also involves community and people. People are key as elements of public health leadership. Employing new technologies. If somebody says, "Oh, I'm not familiar with any new technological platform," for example, Instagram came, then how many people knew that if you're not familiar with how to communicate with your audience in Instagram, then you will be lagging behind. Not that you have to have skills in everything, but you must know that you need to bring a team that is interdisciplinary, cross institutional, cross sector. Networking abilities. How do you improve your network? Many times we go to conferences, we share our business cards, we come back and we never do follow up. Networking. There's a skill set which is requiring. So, one of the things I always highly recommend, whosoever you meet, send them an individual note of thanks that you met with them. Simple thing, but out of sight, out of mind. So that's how you facilitate. It cannot be just always transactional. It has to be more relational leadership also. So interpersonal skills are very important role. Yes, as much we have talked about advocacy, but I've realized in my role, even as a dean or as a founder of an incubator, diplomacy plays a very important role, and advocacy and diplomacy goes hand in hand. And then change management is a critical component. Effective public health leadership, therefore, often involves a combination of adaptive, situational, transformational, and ethical leadership. It's not one style of leadership. It's a complex. So public health is a complex web. Think of this way. You can't, so if you have a house, you have a doors, you have a windows, you have a kitchen, you have a living room. You can't approach the same problem with the same sort of a mindset. So, which means think of a program and a policy as a compartmentalization approach that is built on building different blocks and how you will approach to address each of this block in a different way. But with one common shared goal to create a resilient and responsive public health environment which leads to better population health and very important is organizational success. So, last part of our presentation is going to be essential qualities of a public health leader. Now, I hope I put this slide, two slides. I was thinking that okay, maybe I should give this as a take home assignment maybe. So today's Sunday, most of you might have a holiday. I would suggest you go back today, take a note of this slide and say, okay, vision, inspire, influence, motivate. Do you think that you have the vision for A, B, C, no matter what? What are you currently doing that is helping you to inspire, influence, and motivate somebody? Have you made any tough decision making choices? Emotional intelligence is a very important skill. I'm telling you that. Sometimes, when as a public health leader, you have to engage with many people at the same time. I run an incubator. I have different kind of hiring people that I have to do. Sometimes they have emotions. Sometimes I will have my own emotions. How do you really recognize and manage those emotions is a critical element. Adaptability and resilience, able to adjust to new conditions and recover quickly from difficulties. You have to remember, if your own morale is down, the morale of your team is going to go down. So public health leadership does require that, yes, you have your emotions, but then you also have to really recollect and recalibrate yourself so that you can recover quickly from the difficult situations. Ethical, very important. Highest level of moral principles and professional standards we must have in public health leader. Transparent, openness and honesty in communication and actions. Team player, works effectively and cooperatively with others. Business skills, you must understand that at the end of the day, public health has a business element to that. Ability to lead change, empowerment, delegation of responsibilities and tasks, mentorship, humility, time management skills, organizational skills, networking. feedback friendly. These are very important element, and I really hope that the various schools of public health, they see this and view it. Okay, are we teaching all this stuff? This is not just for public health leader. This is a core foundation today of every public health professional. That's how I see it. It doesn't mean that it has to be the right way, but for example, to me, public health leadership is a core foundational component of public health today. So then active listener communicator prioritizes team's well-being, leads by example. Instantaneous reinforcement is a very important component. If you see something wrong, say it. If you see something right, appreciate it. But you can't say, oh, I'm going to just appreciate and not say things that are important. Conversation is a key element of public health leadership. Continuous learning is a key element. Stress management is important. Conflict management. You can't be in an environment where everybody's going to be always agreeing with you. But how do you manage disagreements in a constructive way? Advocacy is a key element. Sponsorship, collaboration, embrace innovation technology, foster leadership qualities, research skills, and critical thinking. And to me, I think these are a list of things. They look so many, but if you really think from a very independent lens, you might say, you know what? Actually, I need all these skills to do my day-to-day work. So if you really look at it, and then you should go back and say, okay, what is where I'm weak in? What is my strength? How do I build on my limitation? And how can I use my strengths to motivate and inspire others? And that's where public health leadership also comes, where you all work together to build on each other's strengths and limitations so that we can all grow together. So there's a process of effective leadership. First, identify leadership needs. Define the goals. You conduct your self assessment. Select a leadership style, establish objectives and goals. So, for example, let's say you've been assigned to develop a program A. Okay, I want you to lead this program A. Okay, you've been tasked on that. So, use that as a case study. You say, okay, I need to identify what my needs are, what the goals are expected of the program. That's one. Let me do self assessment of the team that I have. Third, what leadership style I'm going to employ to make sure that that program succeeds. Fourth, how do I write objectives and goals that include both short term, intermediate, and long term so that there's a communication to my team that this is the goal and how we plan to approach. Build a supportive team. Match tasks to team members. One of the very important things is that right people need to be in the right roles. Now, there is sometimes uh, roles might change because people acquire skills over a period of time. So instead being fixated to the roles that somebody might be a year ago, a public health leader who's a good mentor will identify that and make shift in the role. So role shifting is a good sign because that helps people to either appreciate or whether to get a feedback on how to learn better. Communicate expectations. Training and development. You can say, okay, fine. For example, I have a program which is called Swasthya Pehal, Health for All. So if I take that program over here, I say, okay, my goal is to reach 10,000 people this year. Okay, let me assess what needs do I have to have. Okay, what leadership style I'm going to use? I will use multiple leadership styles. I'm not going to just use transformational style. I'll use situational style. I'll use some participatory style, and I'll use some behavior change style. I write my objectives and goals. I say, guys, we need 10,000. And when the participation leadership happens, they say, realistically, we can't achieve 10,000. Maybe we should go for 5,000. Perfect. You came up with a goal. That means match tasks to team members. I have 4 team members. Okay, now how do I have to accomplish this goal? And are the right people in the right goals? How do I communicate? You always communicate in writing sometimes, and sometimes you should not do in writing also. Because then that could become limitation. Then people will view that as okay, this is A, I will do B, I will do C. Even though many people, I can tell you in my own role, a lot of people who worked with me, they will say, tell me my roles and expectations. Yes, I can, but I don't want to bundle you because you might be good in something very good. So you have to have a balancing line on what the strengths and limitations are for each of your team members. So then some of the last public health leadership barriers to success, fail to articulate and act on a clear public health mission. Sometimes many things comes, okay, we were not able to accomplish why. Inadequate resources, decision making was inadequate. Unequal distribution of public health services and resources were there. Leadership attrition happened. Inadequate partnerships, broad stakeholder engagement, funding inadequacies, and lack of financial support, and communication barriers between different levels of government. So think of a way that if you have a program and that program doesn't work, you can't just say that the program was bad or the program was not good enough. You first need to understand that there could be not necessarily one reason that could have led to that. You must reflect back on its implementation, identify what the challenges are, find refinements and solutions to each of those challenges, and apply in the systems thinking way on how to achieve that broader thing. The way forward. So, this is my last slide. I think I'm perfectly on time. Way forward. Today's public health leaders must support inclusion, collaboration, and empowerment. If you have only inclusion and no collaboration empowerment, it's not going to work. If you have just empowerment and then there's no inclusion, that is not going to work. You need all three. So, inclusion means creating and championing policies, proposals, and programs that support people from all backgrounds. Underline it. Collaboration, bring together stakeholders with different perspectives. You don't have to bring people all the time who agree with you. For example, in my incubator, I don't hire people only from public health. I want people from all backgrounds. I want diverse opinions. I want some different perspectives. Empowerment, share resources including vital public health information so individuals and communities can make the informed decisions to promote and maintain their own health and safety. So the goal is here inclusivity, collaboration, empowerment, systems thinking, bringing the data and evidence together, and have multiple levels of different leadership styles depending on different situations you are in. No style one is better or good. And plus, at the last, feel free to reach out to me at ashish1875@gmail.com. I just want to say that thank you for taking the time to attend this session on this Sunday where we always want to relax, and but I try to do this every month. I think I have forgotten now, but it's not about whether four people attend, two people attend, 10 people attend, 100 people attend. Does not matter. What matters is I am willing to share my experience with others, because many years ago, when I was being a clinician and I was looking for this kind of information, I did not had a platform or an opportunity to learn this. And I hope that this experience and this knowledge sharing might help you in certain way. I'm not sure about that, but at least I can bring, my job is to bring this forward. You may find it useful, great. You may not find it useful, I don't know. But my hope is that please go back, and my one thing which I will tell you that every week go back and reflect on your own decisions, and also reflect on the decision for whom you are working with from their lens. I'm sure that you will be able to whether appreciate what you're doing, or you'll be able to learn what you are doing, or you might able to kind of refine the way you are doing things. So don't look things from just on your own lens. Look at the lens of others so that you can make more, better, uh, more informed, and decisions that are well thought through, well articulated, and not just reactionary. Okay, so thank you, Shweta, for a wonderful opportunity, and my team. I cannot accomplish this without my team at FHTS. I always tell them it's been 13 years we've been in this journey, and people have come and gone. New people have come, some people have gone, and the task goes forward, the mission goes forward, and that's what the hope is. And I'm open to any of your questions.
Thank you, sir. I would like to extend my heartfelt thanks to you, sir, for
Thank you.
sharing
Thank you.
your expertise and practical insights on public health leadership. So, we would now like to open the floor for questions. If any participant wishes to ask a question, please feel free to unmute yourself, and you can simply type it in the chat box also. Sir, we are getting many messages in the chat box for appreciating the session and the very interesting deliverables by you. So, I think as we come to close this session, I would like to take a moment to reflect on the key messages that were shared and emerged throughout this discussion. Effective public health leadership is not only about knowledge and technical expertise, but also
Shweta,
about.
I think Tanya has a question. So,
Hello. Hi.
and then there's a question.
Sorry to
Yeah,
bother
Tanya,
you.
go ahead, please.
I'm not sure if my video is visible. Just give me a moment. Uh,
Sure, sure, sure. Yeah, your video is visible.
hi, sir. Hello, everyone. Thank you for such an amazing session. I just want to ask one question. Currently, I'm working in an organization, and the sort of dynamics of the team, the reporting manager keeps changing every now and then. So I think I am probably the only member who's been working on this project ever since the inception of this project. So when you told about, not always you have that title of leading the people in your team, I could totally resonate with that thought. But one thing I find it very difficult to, say out things because new people come in the team and there's a hierarchical structure. But I really find it difficult to communicate to them, okay, this is the problem and that's how we have maneuvered it in the past. And so maybe just a few tips you can help me out with.
I love it. This is such, thank you, Tanya, first of all, such bringing this question forward. This is, now let me tell you one thing. You are in a very hierarchical structure. I think I will just share with you that I have a very horizontal structure in my organization. I don't have a hierarchical structure. That's one. And there are both pros and cons of that. But let me tell you one thing that might help you. Okay. If I were you, if you don't mind, can I ask you a follow-up question and you may refuse to answer or what doesn't matter. How long have you been in this project?
Almost 2 years.
Wow, that's something. Okay, if I were you, if I were you, I don't know if you've done this or not. I would document your reflections in all the scenarios.
Okay.
That gives a historic context to your project. And I'll give you an example of that. Let's say the project, let's say I'll give you one example that I have a project right now, which is Swasthya Pehal. It aims to basically improved screening of people with chronic non-communicable diseases in the community. So let's assume I'm Tanya now for a second. And Dr. Shweta is my reporting manager, but she's a very good person. Trust me. So I'm just giving her as an example. Now, prior to that, let's assume that Dr. Mansi was a reporting manager, right? So she has a different expectations versus Dr. Shweta's expectations. Her way of working is different versus other person's working, correct?
Yes.
But if you would document that the previous reporting managers' expectations were what, and how in all situations you did responded, in some cases the things did not work or worked, both the sides, and you have a historic document of that, I promise you. And now you have to give incentive to your reporting manager also. That's a diplomatic way. You can say, see, I've been on this project for about a year, here's what historically it has educated and taught us. You know what is going to happen? You will become a very important asset to any new reporting manager that gives you an interesting lens, because sometimes we do things in our hair. We don't write. We are always working. So documentation is not necessarily for evaluation purposes. Documentation is for reflection purposes. What worked in the past, what did not work in the past. How you responded to the challenge versus how you did not respond to the challenge. And I think if I were you, I would actually go back today, maybe take a week and put the launch of the program since you started. How many team members were there? What were the, you don't need to name the team members. Your goal is not to say this team member was good or bad. Your goal is to say how was things being addressed, what were the complexities, what were the pros and cons of each of the things. And believe me, you will, I promise you, you will get so many answers yourself that you are not even imagining today. And if I may request you, take it as a homework assignment to be done in 1 week. Feel free to reach out to me and let me know how this changed or evolved.
Sure, sure, sir. I'll definitely reach out to you.
I don't know if it has helped you or not, but I'm just
No,
giving
no,
you a
that
very pragmatic answer to something that you can do, what is in your own hand, that might actually give you a better way to communicate with your reporting manager.
that is very true. I feel so over the last 2 years, almost 2 years, three people have come and gone. I think individually everyone is super amazing in what they do. It's just a matter of time, the time they spend in the team, and when the whole team comes together, then something happens and new person comes up. So a
Let me
little,
tell you one more thing.
but
Can I give you one more advice?
yes, yes, please.
No, this is not advice. I take my word advice back. If you believe in the core mission of the project, for example, uh, I don't know how your structure works, but this is such a very important. I can see this problem in many situations because there's a lot of attrition and turnover sometimes in the organizations, right? That should not deviate you from the core value of the project. Think of that way. So I think if you are doing any project, if I were you, I would not just document that, but I would actually even write a blog, if I were you, on how to respond to attrition where the teams work. That might give you a very interesting lens of about that. So I think many times we don't reflect, we just go with the flow, right?
Yes, yes.
So I think in this case, you should have some moment to go back and reflect upon how you have come along for those 2 years, and also think through why people have left. Maybe there's a good reason that people have left. There's nothing wrong in it. Trust me on this. Sometimes I have hired people and they have left in a month or 2 months. That doesn't mean that they are like, oh, that I was bad. You see my point? So, but you should have the rationale to make everybody aware why you made those decisions. Those are very important element. So I think I am uh, I'm just grateful to you for you asking this question, because the whole purpose of this presentation was, even if your one question can help any other person, I think it will go a long way. So, but feel free to reach out to me, and no worries. Anytime you feel that there's any challenge, I can just share my experience to you, and maybe that will help you.
Thank you, sir. Can I request your email to be shared once again in the chat box?
I will put my email in the chat box, and believe me, I will put my WhatsApp number, and trust me that you will find me very quickly respond to people's things. Now, sometimes I do not respond, but this is my WhatsApp number. +1 because it's a US 435706018. And I'll tell you, I'm as much as I am I am very flexible, but I'm also very accountable. And that's an important thing that we must have in leadership. So maybe you should go and talk to the person who your reporting manager reports to and tell them that you've been here for 2 years. Maybe you should take control of the project. I've done this many times in my team.
Definitely, definitely, sir.
Trust me, this you see, you've been there for 2 years, right?
Yes,
So
almost.
you're the most longest serving person. It is but natural for you to become a leader in that. That's called horizontal structure. It's not a hierarchical structure.
Yes, yes.
Okay, there's another question I have from Neha. How to initiate? So Neha, if you can speak up if you want to. Like, I'm not very clear about your question here. How to initiate towards public health at the individual level? Can you a little bit elaborate, like what you meant by this?
Hello, sir. Uh,
Yes, 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 Neha.
so actually, my question is that as we are in the college as a student on this individual level, how we can initiate our step towards the public health?
Very good. Is it related to public health or is it related to public health leadership?
Uh, at this level, particularly towards public health, I guess,
Okay.
rather than public
So
health leadership.
fantastic. They both go hand in hand. So let me say this to you. You are in a college and you want to initiate something in public health, right?
Yes, sir.
Okay. Now, there are many things actually you can do. So I don't know where you are located and I don't know, but let me give you context. So let's say you are in a city A and you are in a college B. Okay. And now Neha feels that she wants to initiate something in that college, in that city. If I were you, I would start from my backyard, which basically means if there's any problem which you see in your college that has implication or application about public health, I'm sure that you have student organizations or student associations. If you have them, go and present them an idea about a very simple thing of creating a public health celebration day every month. Simple. You can say, for example, I know that January 23rd or January 26th, I'm forgetting, there's a National Girls' Day or something like that. I'm forgetting it right now. So if I were you, I would go and tell them there's a National Day coming on January 26th or January 23rd. How about let's do a campaign to promote something around that? Simple. And I will tell you, you'll be so surprised that so many people will come forward to help you out. And even if they don't, you take the step and create a flyer on some of the common problems that might be there and start a momentum. So the first thing is that I gave you an example where you start something around public health. The second, I gave you an example how you have brought in your leadership role even as a student to start something in public health. I don't know if I've answered your question, but I tried my best based on the information you gave me. I think that's how you, if I were as a college student, I would do that. Let me give you one example if you don't mind. Just one more example. My daughter was in grade second, and that might help you. She was in grade two, and I got a call from her school principal in New York that can you come and meet with us? So I said, yeah. So normally when you get a call, you get very worried, like, oh my God, everything okay? I hope she's not done any mischievous thing. So I went to her school, and my her principal told me that we ask students for 50 minutes to do any activity they want to do, any activity. So she, even in grade 2, has been hearing public health in my home so much that she designed 5 question survey on public health in grade 2. The first question she asked students from grade 2 was, tell me about your dream of life. And I still have a copy of that survey with me. So can you imagine from that small initiative A public health club was established in that school in New York from a student from grade 2. So, as a college student, establish a public health club in your college. And if you need any assistance, I will be very happy to help you because you will be able to cultivate something that is so much need of the hour. So, hopefully, that was my response to your question. I don't know if this makes sense or not to you, but I tried my best.
Thank you, sir. Thank you for the acknowledgement regarding the question.
Great. Okay, Dr. Aarti has this. How can do better documentation in a project as co-evaluator? Because you said that evaluation is a reflection of documents, but team leader prepare document. Then what's my role? Ah, that's very interesting. It's a very interesting question. What I'm starting to see is a very, if I may interpret it, Dr. Aarti, it looks like a very hierarchical structures in which you guys are working. So it's a very interesting thing. Now, I will not be doing justice if just based on this I respond, but I will try to respond in the best possible way. If I were you, and because in some situations it's very difficult because team leads are there and they just want to do the things the way. But if I were you, I would not step back. I would send an email about your participation or your thoughts about the project. And if you send your thoughts, two things will happen. One, your thoughts will be ignored. Second, they will be appreciated. Third, somebody's going to call you in their office and say, why did you send it? Okay, these are the three scenarios. But you must do that and then wait based on the response you get. Because right now, there may be no vehicle for any such level of engagement where your input is getting in. So the best way for the input is that even if you are not being asked, you just write an email and still send your input. Does it make sense, Dr. Aarti? Fantastic. Dr. Varsha says, okay, I don't know. I think I've answered anything or something which is left. There's one more question. Okay, one second. Let me see this now. I don't know.
So
I think I've
sorry to
answered everything.
interrupt, but there are questions above also. Oh, one question I would like, it is from Malvika Nayak. So she says that could you please give us a short note on conflict resolution, maybe from your own experiences, preferably as a leader in public health field.
Malvika, thank you so much for such a question. Let's say this way. I'll give you one example, which is a real example, actually. So, in my role as an administrative leader, uh, there was, let's say, an individual who was appointed by my predecessor in certain capacity. Okay. And now, me coming as a new administrator, looked at the things and I felt that that was not the right person in that role. And then the thing is why, like, okay, how do you change it? Okay, how do you approach this problem? So I, when constituted that there is, I first of all, I must know that the change that I am intending to do must be on two things. One, you must have the data and the evidence to support your rationale of the change that you're making. Because if the conflict happens, you must have sufficient evidence to support your narrative. That's one. The second component happens why you are having that change, because conflict might happen whenever you're making change, or it could be anything, right? So in that case, what happened, there was a person who was running a program A, and I just didn't find that appropriate that this person is doing, because their strength was something else, but they didn't want to leave that, and they were holding to it, and it was causing damage to the larger institutional benefit. So my way of doing that was, one, before I could make the change, I generated evidence of what was missing in the current practice. Okay, that was one. Second, I built a task force so that they can generate enough evidence on how and what is needed to be done that is happening around the world, because if we don't make a change to our program, then that will keep us very much on the back foot. So rather than me individually handling that conflict resolution, you built the data and the evidence of the programmatic changes that other schools and programs were doing, so that I can bring that evidence to the group and then let them evaluate the situation. And all of a sudden, it was such a smooth transition, because one, I was open in my way of responding to this crisis. I was transparent. I formulated a committee. I generated the data and the evidence, and I just did not react because of somebody's assumption, but I was proactive, that I have the sufficient tools in my hand that when I bring this change, there will be the least conflict that will backfire on me. Does it make sense?
Yes, sir. It makes
And this is,
sense in the context of the question. Thank you so much.
thank you, Malvika. This was a very good question. I'm glad that you actually asked this. And I,
Thank
what
you,
I'm
sir.
giving you as an example is a real example. I'm not making this up. I can assure you on that.
Absolutely. And I think we can all learn better from first-hand experiences rather than textbook experiences. So that was very nice of you. Thank you.
No worries. Thank you, Malvika. Thank you so much.
Thank you, sir. I think we have answered all the questions, and I thanks all participants
Yeah.
for your and their active engagement. So before we conclude, we would like to take a group screenshot to wrap up this today's session. So
Yeah,
please have
Shweta, I
your
just
cameras on.
realized. Yeah, I just realized that we should do this quick, because I have another talk in 10 minutes. I did not realize that until I've been told now. So I need to make sure that we take. Thank you all. It was wonderful seeing you, meeting you behind the cameras, hearing your questions. I love it. Hopefully, you will find this interesting, enriching, exciting. Please feel free to join our next month. I think it's. I'm going to bring all these kind of topics, and anytime you can reach out to me. Okay, I've given my email. I've given you my WhatsApp. Feel free about that. All the very best. Let's do, Shweta, whatever we want to do, and we. I move to our next meeting.
Okay.
Uh, so the screenshot has been taken. Thank you,
Thank you, sir.
everyone, and have a good day ahead. Thank you so much, sir. Thank
Wonderful.
you. Thank
Happy
you,
New Year to
everyone.
all of you. Okay. Take care, guys. Bye
A
bye.
very happy new year, everyone. Thank you so much. Thank you, everyone.
Bye.